President Obama is planning another online interview to promote the health care law, this time on WebMD. It'll be online. Our next guest calls that ironic. Senator John Barrasso is a doctor and chairman of the Senate Republican Policy Committee. How are you, Senator? And
thanks for having me, Bill. Great.
What's the irony about this?
Well, it's interesting because WebMD is actually more reliable and more popular than the president's own website, healthcare.gov. And as more and more people are going to be losing their doctors and not being able to afford coverage under the health care law, they're going to be turning to WebMD. You know, the Bible used to say, physician, heal thyself. Now it's going to be patient, heal thyself.
You're a doctor. Do you still believe this law makes it harder for people to find a doctor?
Well, I think it's going to actually get worse for those who signed up on the president health care law, specifically because we know that one of the things in the health care law is the cuts to Medicare Advantage are going to affect about 11 million our seniors. They're going to have a harder time getting a doctor. And for those who have signed up on the internet and signed up with healthcare.gov, we know that in their own exchange, they're going to have fewer choices for doctors than other people who buy their insurance and get it privately in the same communities. So it's going to be much, much harder. Plus, we know we're facing a shortage of about 90,000 doctors over the next 6 or 7 years. That includes specialists as well as GPs and family physicians. So patients are going to have a harder time getting care, even if they have coverage.
Well, you were making a speech, what, over the weekend? Was that at CPAC? And you were making the case that people will diagnose themselves by going to WebMD more so than they would their own doctor? I mean, do you really think that's the future?
I think that we're going to the health care law hires 15,000 more IRS agents, but doesn't train doctors, nurses, physician assistants to actually help take care of patients. There aren't enough health care providers out there. And what the president's doing by going to WebMD, I believe, is trying to appeal to young people who've already made a decision that this health care law isn't working for them. The premiums are too high. They have to buy insurance, government mandated insurance, that's not necessarily right for them. It's more than they need, more than they want, more than they will ever use. So the president, I think, is aggressively going out to try to recruit more young people. You're going to see ads during the basketball tournament coming up, all aimed at young people who have already said no to the president.
There's a lot of advertising going on in a lot of different states, too. This isn't quite between two ferns, shall we say. So this is WebMD, and it's a Q&A online. You're a doctor. What are the critical questions you would ask the president then?
I would say, ask the president, why can't I actually go and buy the insurance that works for me or my family? Why do I have to buy all of this other insurance that isn't something that I need? Why can't I make a decision in America of what's best for me? And who are you to tell me that I must buy a government-approved program or policy? And who is actually going to take care of me, Mr. President? So I would say to the president, why don't you just work with Republicans? We have solutions on ways to actually help people with pre-existing conditions get care. Why can't, Mr. President, why can't I shop for something that works for me, and why do I have to buy it from your exchange? Why can't I go and buy across state lines?
We're going to pay attention to the interview, and we'll see if any of all of that comes up, okay? Senator, thank you. I know you leave for Ukraine tonight. Be very interesting to get your reflections on what you find out in Kiev. Thank you, sir.
I'll be happy to talk to you when we get back. Thanks,
Terrific.
Bill.